Living and playing in Central Florida means hot days and high humidity, and an increased risk for dehydration, heat stroke, heat exhaustion, and heat syncope, which basically means fainting. The best defense against these potentially life-threatening heat-related illnesses is a game plan that you can put into action quickly if needed. Let's look at the signs of dehydration so that you know when to take a time out for a water break. Mild symptoms include thirst, dry mouth, and muscle cramping. If an athlete begins to experience these, take a break and rehydrate. More severe symptoms include weakness, dizziness, and fainting. If these occur, take a break to rehydrate and make sure you fully recover before considering returning to physical activity. During physical activity in hot weather, try to schedule water breaks roughly every 20 minutes. Here's the game plan for rehydration. Encourage drinking water, electrolyte replacement drinks, or sports drinks until you have to urinate. If urine is dark yellow, continue rehydrating. If nausea or vomiting occur, intravenous or IV rehydration at an urgent care center or an emergency department may be needed. And if an athlete is confused, unusually sleepy, or does not urinate within 12 hours, seek emergency medical care. Heat stroke occurs when the body's temperature exceeds 104 degrees Fahrenheit or 40 degrees Celsius and can no longer cool itself. It is the most serious and severe type of heat-related illness and can result in brain damage and even death. Signs of heat stroke include seizure, unconsciousness, confusion, lack of sweating, which could mean hot and dry skin, rapid pulse, and rapid breathing. For any sign of heat stroke, call 911. Signs of heat exhaustion include increased thirst, profuse sweating, lightheadedness on standing, cramps, headache, weakness, poor coordination, and nausea or vomiting. Heat exhaustion is less severe than heat stroke, and emergency treatment is typically not required. It should, however, still be taken seriously with the athlete resting, rehydrating, and ideally being moved to a cooler or shady area to recover. Heat syncope is fainting due to a hot environment. A young athlete with heat syncope should recover immediately after falling to a horizontal position. If an athlete remains unconscious or confused, treat the condition as heat stroke and call 911. To quickly cool an overheated player, move the athlete to shade, like under a tree or in an air-conditioned space, like inside a house, building, or car. Remove all unnecessary clothing. Consider placing the athlete on their side to maximize the surface area of the body so that it is exposed to the air and to help prevent aspiration if they vomit. If available, apply ice packs to the athlete's neck, armpits, and groin regions. Circulate air across the athlete's skin using either an electric fan or even manual fanning. Also, use a wet cloth or spray mister to keep skin and hair moist. If the player begins to shiver, reduce the cooling efforts. If the athlete is conscious and alert enough to safely drink, then rehydrate with water, electrolyte replacement drinks, or sports drinks. One last thing to remember. Antidepressant medications and antihistamines, such as Benadryl and Claritin, can increase the risk for heat-related illness. Athletes can stay cool and healthy by following these simple guidelines and watching out for the symptoms of heat-related illness.